Okay, so just a little bit on disclosure here, which is the direction we are moving anyway. Children do not tell us with words often that they have been sexually abused, and part of that is they don't have those words. Some of the children that we work with don't have words for private parts, right? But also sometimes they just don't have words to explain what the whole situation was and what that was like. So part of the reason they're not going to tell us with words is they don't have those words. Also, if they're sexually abused before they have a good grasp and developmentally and cognitively of verbal exchange, the brain doesn't store it in a verbal place. The brain stores that sexual trauma and any kind of other trauma as image, not words, and then it can't ever get back. It can't transfer image to word. So even if this child, remembers what happened to them, they're going to have a very difficult time ever getting out a word that is connected to that very early sexual trauma because the brain stored it as image. The brain didn't store it as words, and it doesn't. I don't know which way it goes, but it doesn't translate in the brain to words. So they can say, I know that something bad happened, but I don't really know what. I don't really know with who or when, but I know it. It's in there, like I know it. And you'll hear adults and teenagers I have oftentimes talk about that, like I know something, but I can't remember any of it, and but I know it. They know it, and that's because their brain stored it someplace else. So why would we even use, and this is an argument that some of you are going to have to make, why would we even use play therapy with sexually traumatized children? It's pretty important to know, to be able to explain that, because some people are not going to understand why you're using play therapy. Can't you just talk to them and get them to tell you what happened? Can't you just make them do this, whatever it is? Why would you use play therapy? So here's your argument. This is why you're going to use play therapy in general, and then we'll be more specific about using it with sexually traumatized children. One way, it's a primary way for children to communicate. Play is the language of childhood, and we know that if you've ever watched a child play, and this is what I say to when I went to go talk to law guardians and caseworkers, and that was the example that I was able to use to them. If you've ever watched a child play, you know this. They play out their perspective of their life, and so it's their primary way of communicating. They can show you through their play, but they cannot tell you with their words. And so certainly that's a reason to use play therapy.